right, so everybody, welcome Cristi Cuellar. She's a physical therapist and a Czech holistic lifestyle coach. And like Alex and I, has gone through the Czech program, and she is here in Austin, Texas. And she's been in the field 15 years, as I had said, and she is here to talk with me about. We're going to hash out several things, but one of the big ones is our, what we'd say, the disconnect, as our technology is sort of evolving and advancing, that's providing a lot of patients and us with the convenience and the efficiency to get our coaching and practitioners and appointments in and out, but it's creating a wider gap of disconnection with our healthcare providers, which is creating other problems that we're going to talk about. And a lot of our health issues that we are, in this age of technology, there's information overload, there's information out there, we have access to it everywhere. And so having information isn't the problem, it's just knowing what to do with it. And so Cristi knows so much about stress related issues and how stress affects us and how that physiologically, that what that does to our bodies and what it does to our health. And if we're going to the doctors and we're going to the PTs and we're going to the gyms and we're doing all these things to address one single thing, what we're missing is how that's actually stressing the body and what the stress is doing to the body. So she's going to talk about that with us as well. And not least, or least important, is that how this disconnect and separation and all the stress that is still accumulating while we're making so many other advances is this self-image, the body image issues, and the emotional aspects, the mental, emotional, spiritual aspects of it all, where we feel like we are getting a lot of information and there is a shift collectively and socially to seek and search for that that path and that growth. But with so much of this technology and lack of personal communication and interpersonal connection, how much of that are we actually getting? So without further ado, here's Cristi, and I just want to jump in and ask you first off, what is the biggest roadblock or challenge that you see as a physical therapist and a care provider, with all of these technology advances and all of these efficiencies and conveniences to do online coaching and quick in and out appointments and scheduling and all of that?
Yeah. Well, thanks again, Sarah, for having me on your in this series.
Thank
I'm really
you.
excited to be here. I like that we're connected together because as a Czech practitioner, there's these four aspects of health that I think are really important. And in all honesty, physical therapy doesn't hit all of them, which sometimes frustrates me because when I see a patient, I want to treat them holistically. And our medical system doesn't give us enough time for that because after we finish university and then our grad program, we get a doctorate in physical therapy, and then we're ready to see patients. But most businesses are getting paid by insurance at these small little increments that at the end of the day doesn't pay the rent and pay each practitioner the salary that they desire. So we have to see more patients an hour to kind of pay all the bills, as
Right.
as a physical therapy clinic. And so
So that forces you to
it's
have less
just
time.
it's helped me go onto my path of getting other certifications in treating the patient possibly outside of my clinic and working with them as a holistic lifestyle coach after they've been discharged from, say, physical therapy, or if they've worked with a doctor and the doctor's like, hey, you need a health coach. And I would say that my philosophy is working from the outside in. So like level one is a physical therapist where we look at your joints, we look at your posture, we look at possible trigger points that may be going on in the body. We use modalities like massage, ultrasound, electrical stimulation. I do dry needling, which it works very well with patients that have muscular trigger points or spasms that, just nothing else is helping. I show them functional exercises that's going to improve their posture, improve the joint stability and mobility. And then, physical therapy is amazing. A lot of people need physical therapy. You've told me that you've needed it, and I've gone through physical therapy. That's actually how I got here. I was injured at the age of 15 during cheerleading practice, tore my ACL. There went my identity. And so, an injury really affects your social life, who you are, how you perform, and of course, your activities of daily living. So physical therapy is really important. It's just about working with a practitioner that can possibly work with you holistically. Um, and then, so you asked what do I see the most at the clinic, and it is things that have to do with posture. So at this time, like most patients that come in with upper back pain, lower back pain, I would say 95% of them work at a computer all day. And they're like asking, why do I have this pain? This is so weird. I work 8 hours at a desk, but I'm not really doing anything. I'm not lifting anything heavy. Like, what's wrong with me? I don't get it. And I'm just like, well, yeah. Humans are not meant to be at a computer for 8 hours. Like, we are meant to be interacting with people. We're meant to be going out and grocery shopping, preparing for our family, preparing our food for our family. We're meant to be playing and, just things that we should have been doing 100 years ago. And now technology is kind of like making communication quicker and getting services out quicker, but it's not really helping us as a human species.
Right. And, something you had said earlier is important to note too, is that a lot of practitioners coming into practice are getting paid just certain increments by insurance companies. So they are forced to see more and more patients just to pay the bills, which means that the more patients you see, the less time you get with each patient. And so things like technology and certain CRM systems into the practice will make things more efficient, but you're not getting that real good quality time with one patient and getting to provide that holistic care and attention to them. And even our general practitioner, he's an MD, but he tries to practice very holistically, and he complains all the time that he's forced by sort of this red tape of the government and insurance companies to use certain CRMs and get training to use these CRMs. Otherwise, his practice is fined. And so that means that when he's with a patient, he has to be on the computer. He has to ask a question and click and drag down options, and then ask a question and drag down, click. And so he can't just like sit there and write notes and then talk to the patient. Like he's at the computer. And so it's making
he's not able to like read their body language. He's not able to really ask him how they feel or take the time to, because he's turned his head and he's having to document. And so, it takes a lot of time.
Yeah, and that's taking away the interpersonal connection between the practitioner and the patient, or the care provider, or the coach, or whoever, and the person, the client and the patient. And so what's happening is, yes, it makes things very speedy and efficient, and people can get back to their lives and get back to their jobs and their kids and families. However, how much information is being overlooked? So what are some like important things that are not getting addressed or not being asked or seen with the lack of interpersonal connection there?
Right. And so say that patient is with their doctor and they're complaining of low back pain. The doctor is like looking at them, sitting over slumped in this posture, and they may or may not know special tests.
Mm-hmm.
They'll ask them about their symptoms. Is it radiating? Things like that. And it could be radiating and still not be a disc issue. They might take an x-ray. The x-ray may or may not reveal what the pain is, what's causing the pain.
Mm-hmm.
And so then the x-ray doesn't reveal what's going on. So then they're like, well, here's a muscle relaxer. It's probably your muscles. Here's a prescription for physical therapy. And then I'll see you in 4 weeks. So usually when people have low back pain, they have a lot of things going on. I don't want to bring up chakras, but I would say zones of, like, there's special zones in the body, and the area of your low back is in the same zone or nerve plexus. It's in the same zone as your stomach and your digestive system. And your digestive system is like your second brain almost. You have 95% serotonin is produced in the gut. Digestion is like a huge thing that goes on in your body. And so say you have digestive issues, most of your blood flow is going to be going into your gut. So maybe there's not regeneration or some, healing going on in your back. But plus, the posture is a big thing. And a lot of people are not taught the proper muscles that need to be toned with low back pain. They're not taught posture. Sometimes they don't know that they're even in bad posture.
Right.
So working with a physical therapist is great. Again, the scheduling is a tough thing because learning transverse abdominis strength and core stabilization doesn't take 5 minutes. I mean, the patient needs to feel what it feels like,
right.
Needs to learn how to breathe, what a diaphragmatic breath is, and sometimes that takes about 45 minutes. Well, guess what? That's like your whole physical therapy session. So the patient, also needs some possible manual therapy and some other stretching techniques, and sometimes it takes a whole session. So,
yeah.
A lot of patients think that a physical therapist is going to solve their problem in one visit, and that's not always the case. I'm sure you've seen that with your clients.
Yes. No, I mean, a lot of this stuff, lordosis, for instance, that postural dysfunction in the back, a lot of that we see with women who wear heels a lot, and arch their back, or because of wearing heels all the time, you're kind of forced to arch your back, and so you're just forced into this lordosis of the back, and then it can become very painful. That can take up to a year of like very diligent work if it's bad enough, and then very, very diligent work, and you have to do very corrective exercises, and that's saying, like, if that's the only thing going on and you don't have any other musculature length tension imbalances and other lifestyle issues that would interfere with that type of physical therapy. And so that kind of stuff can be, for a lot of people investing in physical therapy, there's like a stigma attached to it. It's like, oh, I gotta go to physical therapy, but I feel like I'll just touch on when I had to go to physical therapy, because I feel like there's not a whole lot. I think it's like I have to do this thing in order to fix this thing, and there's no offense, I'm not saying this in a derogatory way, or a negative way, but there's a victim mentality that something's wrong with me, something happened, and now I have to go through this thing in order to get to the other side. But the value that we're overlooking in physical therapy is like how much transformation you're actually going through with your body each time. Every little thing. You may not be, doing powerlifting and hang cleans and, going on that run around town lake that you really want to do, that give you that adrenaline rush, like you're not getting that instant feedback, right? These very small movements like tummy vacuum holds or, piston breathing and things like that, and holding certain movements and muscles
Yeah.
for a long time.
And you
Like
know
that's
how frustrating
boring.
it is. And it's so frustrating that you go to a physical therapist for this pain that you've been having so long, or, a holistic lifestyle coach, and then they tell you that you've been doing it not so much wrong, but no, this is where it should be. And then there's some guilt and shame about, like, frustration and anger. Like, why didn't somebody tell me this earlier?
Right, yeah.
And I guess I would say that, hey, well, at least it's being addressed now, or
Mm-hmm.
just celebrating the perfect timing of the journey and who you are in contact with and who your accountability and or coach or physical therapist now. I think it's
Mm-hmm.
almost a beautiful thing. So just
Right.
being appreciative and have gratitude that you're learning it now.
And getting in touch with your body as this temple, this vessel that carries you everywhere you go and handles the abuse that you inflict on it on a daily basis. That, if you go to physical therapy and they have you doing stuff that's just, boring, as I used to say when I had to go 3 times a week, um, it the, the reason I thought it was so boring is because I didn't look to the value of what I was doing in the present moment. The transformation that was happening to my body, that I was giving my body that moment to moment, in that minute, in that, those 5 minutes, in that 20 minutes sometimes, like how much was happening and changing in my body positively, as
Yeah.
boring as it may have been, going inside to your body and being so present with it, like, wow, this may not be fun, but this is transforming me into being
Yeah.
this outcome. And the value of that is just, well, there isn't like really a value because it's invaluable. Like to be able to
Yeah.
connect with your body in that way. And I didn't have that. And that's why I hated it. And I feel like there isn't that value to physical therapy or doing these exercises or addressing the zones. The bringing up the zones is so important because back pain may not just be like you're sitting wrong or you got injured. Like what is there's so much else that it's affecting. It's
Right.
affecting circulation to your digestive system, which is where your immune system is built, right? And
Yeah.
if you're limiting circulation to that, then how many people in Austin, Texas suffer from allergies, and back pain as simultaneously. I wonder. I kind of want to look that up now.
Yeah.
And there's all these, like, also in your back. Where are all the organs in your body? Right here. That's
Yes.
also where your spine is. And so,
Yeah. Something that you brought up that I want to touch on is the definition of fitness, and knowing that there's two options, or there's two ways of building up your body. And when you come to physical therapy, your body's been broken down. There's tissues that just gave out, and that tissue needs some healing. Working out is like using heavy weights, running, jumping, like getting a sweat on, like endorphin rushes. Yeah,
yeah,
that's
I see where you're
cool.
going.
CrossFit, marathons, things like that. But some people need to work in. So, working out versus working in, building up the body instead of tearing down the body.
Mm-hmm.
Running is probably the most stressful thing that you can do on your body. There's like 150% of your weight going into your knee joint, ankle joint, and it's a lot of stress. Like, it's really good for your cardiovascular system, but it's also pretty exhausting. And so, what I like to introduce to my patients is that working in and working out and connecting your mind and your body with your exercise is such a great way to start building yourself healing your body from the inside out and working in and focusing on that one joint, focusing on your core. And then even like meditative type movements, they're so healing. And yeah, our society thinks that being fit is like working out hardcore, but man, working in there's just so much value and so much amazing things that can happen whenever you do something with intention and like using your mind to turn on some muscles and have more muscles firing and keep your heart rate down so that your kidneys and adrenals are not moving, because so many people that come in have this hidden hormone imbalance, and it's too much cortisol and not enough testosterone, DHEA, progesterone, good estrogen. Like we're just so off, and like we think that it's normal to be like tired and have bags under our eyes and things like that, and have a lot of like water weight. It's like this.
It's common,
Yeah,
but it's not normal. There's a
exactly.
big difference between how common it is to, for women to pee their pants when they laugh after they have a baby, but that's actually not normal. It's just common. It's common to have bags under your eyes and carry water weight, because so many people have that, but that's actually not human normal. That I like that you said that, and yeah, I like that you brought that up, and it's a good segue into the whole stress thing, because as you said, when people come to physical therapy, it's because tissues have broken down in the body and they need to be repaired. And so what happens when you exercise, when you're running, when you're lifting, when you're doing, crazy burn challenge, or when you're doing all these things, you're tearing muscles, right? You're tearing
Yeah.
tissues, and those need to be repaired. And so work in versus work out. You also brought up how certain zone exercises or certain work in exercises can actually really burn the muscle, but you're not driving that cortisol and pumping your heart. It's so it can be a workout, but you're working in, you're restoring, and we should touch on that in a little bit. We're segueing, I think, naturally here into the whole stress topic of how I think we are shifting very collectively, as a society, as a culture, and with all the information sharing, we have access to so much information. I think um, the average person now versus someone in the 80s or the 90s or even early 2000s, the average person now, I think, has equipped themselves or is more knowledgeable about health in general than before, like way more, because the amount of
Yeah.
information sharing, Pinterest, Facebook, blogs, articles, you can have access to any research journal or article out there. There's so many books. I think that I read a fact about how there's like an average of, it was like 500 something health books being published every year, and like double that on diet. And so information's not the problem. It's, so we have computers and smartphones and CRMs and all this technology to access any information we want anytime. We can download a program, we can download diet meals, shopping lists, exercises, anything we want at any time. So what's the problem? Like, why are we still so stressed out and sick? That's the big one.
Right. In my experience, I believe that we're not connecting heart to heart. We're not connecting, like humans are not connecting and sharing like deep root possible causes and shame or guilt or other emotions that have been trapped in.
Mm-hmm.
Um, and then there's something about like accountability and, you want to talk to a coach or doctor about your progress, and you want somebody to be like, that is so awesome, that is great, like you've lost a pound, or now you're working at your station without pain. And um,
You're
there's something
yeah.
about being, on a program with a coach or with a practitioner that is really great. And people are getting a lot of information. Uh, they can get like the top 10 butt exercises on Pinterest, but maybe they need to talk to a coach about why they want their butt like that. I don't
Right.
know.
Right.
Um,
And then not
or
everybody's butt is actually going to look like the one in that picture.
exactly, yeah, which we're going to bring up later, right?
Right.
um,
No
but
matter how many
I believe that
glute bridges you do.
we all need accountability partners, and connecting one on one with coaches and or practitioners, and we don't get enough of that, or women don't get together enough and go into friendship circles and just share their emotions.
Mm-hmm.
Um, I believe diet and exercise is huge. Is like one of the main reasons why people are healthy if they have a good diet and good wellness exercise routine. But the other part of wellness is the happiness part, and what makes them wake up every day, and why are they motivated to do what they're doing,
Mm.
why um, how sleep is involved and things like that, why they can't go to sleep, why the anxiety and or not sharing their emotions is causing them to have insomnia all day. um, there is a lot of information out there that's like, hey, lavender can help you sleep, but there's not a lot of information on how amazing it is to share your emotions with a coach.
Yeah, or people in general. I mean, even
Yes.
dating is all online and text now, and I'm just so grateful that my dating years, I'm about to reveal my age, but my dating years never happened over text. Like I
Oh
think
yeah.
the latest it was like there was, you remember AIM? It was like AOL Messenger
Oh yeah.
was like the last time, but I'm still even to this day pretty technologically like um averted. Like I have a hard time dealing with all of the technology, but like everything is on a computer, on a phone, or on something. So I even have found myself very feeling isolated when trying to connect with communities, or um, even training, even in college when I went back to college again, and everything was online. Everything, groups, study groups online, forums were online. Everything is online, and it was very very hard to connect. So much so that I was the nerd who was meeting the professor at a coffee shop just to have a conversation because
Mm.
everybody just wanted to do everything online. And you bring up a good point about diet and exercise is so so important, but that's feeding the physical body. And so there goes the disconnection because we have three bodies, right? I mean, if we want to look at it more in, we could go very deep into it and look at all of more bodies than that, but three bodies, right? The physical body, um, the emotional body, and the mental and spiritual body. And so if we're focusing all on the physical body, we're starving these two. And these are starved. When these are hungry, we're going to think they need to be fed by focusing on the physical body again, right? Like, so we're putting so much energy into diet, nutrition, and exercise, um, then we don't have energy to focus on the emotional and the mental and the expressing our creativity and developing friendships and connection and um, what drives our passion and purpose and our what because we don't have any energy for that anymore because we're so focused on
Yeah.
shopping lists and meal plans and getting to the gym, and you know we're tired now. We don't have time to sit down and meditate or do a journal entry or draw or do some art or um, listen to an audiobook and just like really work in, um, because I think that physical body is what drives us. It's always moving. It's always moving forward. There's always motion going, um, and it's that emotional, mental, spiritual body, those two bodies, well, the emotional and then the mental, spiritual, is that is lacking. And so
Yeah.
without the connection with people and interpersonal, um, how can we bridge the gap to developing that and working towards that and finding that connection? What would be the benefit of that?
Right. Um, you had somebody like write in a question.
Yes, I do. You want me to pull that out? Because it's a good one. Y'all, this is
Yeah,
really good.
I think it has to do with something with our conversation.
Yes, so I have a question from, I can use her name, she said. Her name's Jacqueline, and excuse me, I'm going to turn my head over here because I'm reading it. She said, so in terms of body image and physical therapy, I wanted to ask Cristi this question. There's so much conflicting information out there about postnatal rehabilitation that it makes it so hard to make the right decisions, especially after you've gone through so much, you can't sleep, you feel like an alien, everyone is telling you something different, you just grieve your former body, and all the online pregnancy and postnatal programs don't seem to address the emotional aspect of it all, which I guess is where most of this is contained, and they can be expensive, so I don't know what to do but cry and do my best figuring it out alone.
Wow.
Yeah, it was, yeah.
So she just kind of revealed to us that all the things that the Czech Institute touches on, which is she needs to heal her physical body from, she needs postnatal rehab, meaning help heal her body from this amazing miracle of having a baby and celebrating that she just had a baby, but also the physical changes that happen in the body. And, there's a lot of things that she can help to heal her physical body. She's also, it seems like what I hear is that she misses her previous body, which she now, she's seeing change. And then she possibly feels guilt or shame with that. I don't know. Did you kind of feel
That's what I'm feeling
I'm not
with
sure.
it. I feel like an alien.
She doesn't feel like herself. She feels
Everybody
very
tells
different.
you something else. Can't sleep. She's grieving her former body. Yeah. So, I mean, she may not be coming out and saying, I feel shame, but there's definitely an expression of, I really want to get back to where I was, but she does desire to do the right thing and not go, join a boot camp. This is what I'm getting. And
Right.
she's saying, like, I want to do the right things. I want to do right by my body, but I also want to have my body back. And I can relate to her having 3 kids, that the transformation that you go through in pregnancy is very profound, but it's also traumatic on the body. And then birth is traumatic, but you continue transformation for a long time after you give birth too. So transformation is like 2 years of like constant change. And will you ever have the same body you had before? I mean, some people do and can, but I don't know the statistics, but I'd say half of the women don't. And that's not necessarily a bad thing. It doesn't mean you're going to carry weight for the rest of your life. You're just going to be shaped differently because your bone structure has changed. You made a human being, for you crying out loud. Like,
Yeah.
celebrate that shit, woman, because that is insane. You went from being a girl to a woman. Like,
Yeah.
that's
I've
awesome.
seen people have like amazing transformations. Sometimes like I think that they look even more sexy. Like,
Yes.
hoo-wee, I want to have a baby.
Yeah.
Like they look amazing.
Those hips.
First of all,
Oh, yeah.
yeah. Well, So again, going kind of like from the outside in, or trying to help heal the body, I would look into how's her core function, because she just
Mm-hmm.
had a baby and her pelvis opened up to allow her baby to come out, or it's also expanded, having a 6 to 9 pound human in your body. And if she had a vaginal birth, her pelvis has shifted. If she had a C-section, she probably has atrophy from, the abdominal muscles. So
Mm-hmm.
learning how to contract the transverse abdominis again, understanding pelvic tilt, um, knowing what the most powerful Kegel contraction is, um, doing hip flexor type exercise, strengthening the gluteal muscles, energy building exercise, which is pretty slow, almost like Pilates, somewhat like yoga, going for easy walks outside, maybe even doing Qigong,
Mm-hmm.
working on diaphragmatic breathing. Those kind of things are going to help her get in touch with her body and get the right muscles working. So she should, I mean, she's not going to be able to go run like 5 miles again if she was running, but getting, introducing cardio type exercise like walking and being able to walk up and down stairs,
Mm-hmm.
that's where she's going to be at for 3 or 4 months. And that is amazing. That's great. Her hormone levels are probably very off, which sometimes
Yeah.
the patient will have low thyroid after that. Um, some patients like what in your experience, Sarah? What hormones do you think are at fault? Not at fault, but off whenever somebody has post um, traumatic. What is it called? The depression after the baby's born.
Oh, postpartum depression. Yeah, PPD.
Yeah. Is there a hormonal connection to that?
Um, there's a lot, and it just could all be varied. But I think it's also a lot of lack of dopamine, serotonin, um, lack of sleep. It could be, and again, this goes to the holistic model. It could be the food you're eating, not sleeping very well, the stress environment of your home. Um, it could be a lot of things that were brought up in the process of pregnancy and birth that maybe you had carried over from childhood that were I mean, this is the kind of work that I do with women, is that a lot of the trauma or experiences of the transformation of pregnancy and birth and after can trigger a lot of trauma from childhood that had been suppressed or repressed, and that can trigger postpartum depression as well. And the book, The Body Keeps Score, is a really great book to reference for that.
Yeah.
Um, and so that could be that. And again, it could be lack of sleep. It could be eating the wrong foods. And again, if certain hormones are triggered, certain chemicals in the body that have just completely shifted, and now you're breastfeeding and all that nutrition's going to the baby, you may have also triggered an autoimmune issue. You may have triggered a food allergy issue that you don't know about. There's just so many things. And in my experience, a lot of women try to over supplement themselves into fixing the issue without actually knowing what the issue is. And an overabundance of estrogen can be a trigger for anxiety, because that and testosterone, because that can be that can rise cortisol and adrenaline. Or you may not have high estrogen, you may have just really low progesterone, which is the calming hormone. So, I mean,
Yeah.
it could be just so many things. It could be
I
all of
know.
that shit. And then you need a coach, girl. Like, I mean, it could just be so much stuff, but this is such an amazing thing women go through. Uh, it's so important to have a tribe, going back to something you had said
Right.
earlier.
Yeah, a big thing that you like mentioned was sleep.
Mm-hmm.
Sleep is so important. We secrete so many hormones, like human growth hormone, and our body literally repairs itself while we're asleep. And when you have a baby, your nights are not, they're disrupted because your baby has needs, right? And so communicating to your partner and knowing that you're in a healthy relationship where you can really not lose yourself in the relationship and communicate your needs and how important sleep is to your partner, and him be open and be able to like work with you on that is really important because man, the woman just went through a huge stress, stressful surgery miracle,
And
and
it's
so her body
traumatic.
really needs time to
Yes,
recover.
absolutely.
Um, but yeah, I would want to ask Jackie how her body feels and what her strength is like, what her sleep is like, and also not that she needs to, eat like under 1,500 calories again to lose weight, but also understand like what her metabolism is like right now and um, what type of plate she needs, like what portion sizes. Does she need to go on a keto type diet? That's the big thing right now, keto diet. Oh my gosh. And some
Mm,
women cannot be tolerating that type of diet. And then there's the vegan option, which has very little protein and can like actually increase fungal overgrowth and
yeah,
candida and other bacterial infections that you may have
which will
in your
increase
gut from
anxiety.
do what?
I sorry to interrupt. I said which will increase anxiety.
Yes,
Yeah.
exactly. And so that person needs to understand what's going on in her metabolism and know that she needs to be on a diet now that's going to help build up her metabolism again. And again, not go online for check out what her friends are doing. She has to be evaluated by a coach that's going to understand her metabolism and stick to that type of eating pattern for
Mm,
60 or 90 days at least. And then, be able to work with a coach that's going to, talk to her about her emotions and know that those emotions are okay. Her expressing those emotions to her husband may not be as much value as her talking to another woman that maybe has gone through the same thing, or a coach that understands that she's had trauma in her body. So, yeah, usually people that have some type of depression or missing their old body, it's just that they just don't know if it's normal or they just want some comfort. So,
well, metaphorically, and we talked about this earlier before we started the recording, is that, when you go through this kind of a transformation, you've also gone through a death, right? A death and a rebirth. And
oh,
so
right.
when you're grieving, as she said, she did say that, right? Grieving. She said grieving. So she actually articulated grieving as if she almost intuitively knows that there was a death, right? Metaphorically, that old her has died. This is now her new her. And so there is a struggle to embrace the new you. And when it's your former perceived ideal self that was you is no longer you, like that's very difficult. That's completely that's a whole shift, and you're trying to embrace that and be a mom right now to a little baby and recover your body physically. Like there's a whole whirlwind of shit happening right now, and like women really like they just do this all the time. um, and so bringing up, like you said, you really need a coach who can address you as the individual is important. And I want to rezone back to that because a lot what she's saying is there's so many online, she said, programs for pregnancy and postnatal that don't address the emotional aspect of it all. Because there's a lot of programs online, not just for pregnancy and postnatal, but there's a lot of fitness programs, health programs, nutrition programs that you can follow online. There's Pinterest, Instagram, Facebook, blogs, anything you can find online that you can just download stuff for free. You can follow people on YouTube and just do what they do because they said this worked for me, right? And they've
Right.
got so many followers that are saying it worked for me too, right? Doesn't mean it's going to work for you because they don't know you and they don't know your body and they don't know your internal makeup and your physiology and your biology and your chemistry, and they don't know your environment, and they don't know what toxins you're being exposed to, and they don't know your emotional stress, and they don't know all of the factors that are going to contribute to your success or limit your success. And so you can this is where I think a lot of the stress comes in, as you were sharing with me as well earlier, that when people get overloaded with all this information, it's hard to decipher and weed through all of this what's working, because you try all of these things and sometimes it works for a while and then it doesn't anymore, so you try another thing and that may work for a while and then that stops working. um, is because you're doing something that someone else did, and you're following something on a computer screen, and you're following something on your phone, right? You're not here. You're not listening here. And so we
Right.
were talking earlier about connecting to yourself, connecting to your body, and bringing awareness into your body so that you can know what is working for you. So maybe a keto diet would work, maybe not. Um, with Czech practitioners, what we teach our clients is a system of understanding what food is right for you and what isn't, with a very easy, like, dial in program. Like within 5 minutes, within 20 minutes, within an hour, how do you feel after you ate? So if these
Right.
systems occur, or you feel these symptoms happen an hour after you ate, check in with what you ate, and that's probably not what you should be eating. Maybe you had too many carbohydrates and that's why you've got a headache. Maybe you had too much fat on that plate and that's why you have loose diarrhea. Or whatever the symptoms may be, tracking your food is, am I right? Like, this is how we help our clients. We don't give them a meal plan. We make them track their food, and which I don't do as much of anymore. But if it's necessary with a client, I will tell them, like, for 3 days, I want you to write down everything you eat, and an hour after you eat, tell me how you're feeling, um, because that brings them into themselves to know how they're feeling and what they're eating, whether it's the right thing or not.
Yeah.
That way they become their own coach. I mean, and they don't need all
Yeah,
these.
I'm really curious about what she was eating and what she think was healthy,
Mhm.
and if she had diversity in her diet. Because we think like a piece of tilapia and broccoli is healthy, and that we should eat that 3 times a day, and then we'll
Yeah.
get our body back. But there's just so many other aspects of nutrition that she possibly needs to explore, and maybe some things about her gut or her liver, that she would like to explore. But
Yeah.
yeah, the other thing is that a lot of women, we're just in constant competition.
Mhm.
Uh, Big triggered word for the next few minutes, because I know we were going to talk
Yes.
about training women in competitions, but we're comparing ourselves to other women in the media is far too much. And I think that puts a lot of pressure and stress on each other. And I don't know, every woman is just so beautiful and amazing. And we're still comparing ourselves to other people that we don't know.
Yeah. Yeah. And the comparison of it is that, there's a quote, and I may butcher this, but um, nope, I'm gonna totally butcher. I can't even remember it. But it's the gist is, when you're comparing yourself to something external outside of you that has nothing to do with you, you have completely washed away anything of value that you
Mm,
bring in, right? Like, you've totally forgotten every achievement, everything you've overcome, everything that you all the joy you bring to people's lives, all the things, all the beauty people see in you, you've just washed it away when you compare yourself to somebody. And a lot of times people think, well, I'm not comparing myself, I'm just admiring or wishing. And it's like, that is comparing, right? Like, because it's a contrast. You're contrasting. That's
Yeah.
comparing. And if it generates any sort of emotion or feeling of, sadness or shame of yourself, um, when you look in the mirror, you're comparing, wishing your butt were a little higher or your boobs were a little fuller or maybe your hair was thicker or, speaking for a friend, you know, like I'm not discluded from that population. I do it to myself and to this day even. But when I look at myself in the mirror and say like, oh my God, my ass, like what happened to you, girl, right? Like then I realize, well, Sarah, you're not eating enough protein lately. Like it's your fault. And like I do the things and adjust to it, but I still do that. I still do that to myself. It's like ingrained in us. And like you had shared with me an experience you had that really like just kind of flipped the coin for you, so to speak, in your life, where you were doing a competition, right? Like you were in competitions, right? Will you tell me about that? Well, you told me, share that with us first.
Yeah. So let me see. Back in 2007, um, I was living in Las Vegas. I was a traveling physical therapist, but I was also enjoying living in Las Vegas. And so that was um, every Friday, Saturday night, maybe Sunday during the day, going to a beach party and, drinking every night and then going to a yummy breakfast the next day and then just being in this vicious cycle of, I'm so tired, so let me have like a bunch of caffeine. And then the next day, going out, like staying out all hours of the night, partying, and then, eating at 2 a.m. or whatever. So my body wasn't like feeling good at that time. So I came in contact with a girl that worked with me that did fitness competitions. And so I was like, oh my gosh, that's so amazing. I've always wanted to do that. Um, in high school, I had, I was muscular. I was a sprinter. I had muscular legs. Some days I'd like lift up my shirt and be like, hey, I have abs. And then other days I wouldn't have abs. And I was just like, what makes us like sometimes have more abs or have more muscular definition? I just really was into that. A lot of really good athletes that I admired had very muscular physiques.
Mm-hmm.
And I just thought it was so amazing, like amazing physique, amazing athlete, amazing, like, um, I don't know, they were very praised. So I wanted to do that. I trained 3 months for a competition. It was a very restrictive diet, but I started feeling like my mental clarity was better. I had more energy. I was really excited to work out because I had a really good routine. The food was restricted, but yet, like, it gave me, like I had borders and I stuck to it and I just felt more disciplined. And being in that discipline just made me feel more compliant and control. I had
Uh-huh.
this sense of control. So after the first competition, I won, and I was like, "Wow, this is amazing!" And so I did a few more. I did like 2 a year
Mm-hmm.
for like the next 2 or 3 years, and it was in 2011. I was just, I was just so tired because you have to work out like 6 or 7 days out of the week.
Mm-hmm.
You can eat a certain amount of calories for 8 weeks, and then the last 4 weeks, I mean, it's so restrictive. You have to be doing almost an hour of cardio every day,
Yeah.
eating a lot less, and then you have your full time job. You may be in a relationship, you may have a new pet. You're
Mm-hmm.
trying to balance everything out. I was freaking tired. Like, so I remember waking up and going to that competition and being bloated. I hadn't even gone to the bathroom. And
Wow.
so somebody gave me a diuretic. It was like a medical grade diuretic.
Wow.
Yeah. Plus, like I wasn't drinking any water. Plus, I hadn't gone to the bathroom, so I took some tea to help me go to the bathroom because I was so constipated. But anyway, my body just didn't look very well that last time. Now that I look back, I was like, oh, you looked amazing. But compared to the diet I've done, I should have been like super ripped. So anyway, I just remember just being so tired, so hungry, just so tired of this shit that I was just like, I stood on stage and I was just like being compared to the other girls, and they were making us turn to the back, stick, kind of stick your butt out, turn to the side, turn to the front, pose this way, pose that way. And I was just like, what am I doing here? I like looked down into the judges, and I swear three of them had white hair. Like it was three men that had gray hair. And then these other ladies, I'm not saying that being overweight is bad, but it was two overweight ladies. And I was like, they are judging my body
Well,
right
there's a good
now?
chance they were former competitors
Okay,
who have
well,
metabolic issues now. I'm not saying that in
exactly.
a bad judgmental way, but that happens a lot.
Yeah. And so I just had this realization
Yeah.
like, WTF, what am I doing right now? I'm so hungry. I'm starved. I've trained really hard. And now I'm going to be placed, and I'm going to feel really bad about it. And it's all because of what they think that my body should be. And
Mm-hmm.
this is not what makes me happy. And what I wanted to do initially during a competition is see the transformation of how exercise and certain like exercises can help develop the deltoids or help round the glutes. And like I think it is cool. I think shaping the body with certain exercises is fun, and it's good to see our progress.
There is a
Um,
nerd aspect to it for sure. It is interesting.
yeah,
Yeah.
yeah. But like after a while, the competition and the rankings mean more to you than being healthy, and that's what was starting to eat me alive. Like I was just so tired of pleasing other people and maintaining this outside look just for them, and inside I just wasn't happy.
Mm.
What I really wanted to do was, just I don't know, kind of be affirmed that my hard work was um, was good and worked. And yeah, I didn't have balance at that time. So what I would say is that it was just a lesson in balance, in um, doing exercise and keeping myself happy, and then balancing out, you know, uh, like how I pleased others. That
Mm-hmm.
started to like develop a shadow in me that I'm still working through today. I mean, like trying to balance on how much time do I need for myself versus how much time am I giving everybody else,
Mm-hmm.
making others happy. And being in the health industry, we're always trying to help other people. But how much time do we give them, that we prostitute our time for their happiness?
Uh-huh. Wow,
Huge
that's
thing.
huge. And that, you know, the prostitute is an archetype of if anybody studies Carl Jung, um, it's not what on the superficial level what you think it is as a prostitute, but it is the sacrifice of giving more than what you are actually valued. Like you're not valuing yourself, you're giving so much than what you're taking back in or receiving or asking for, right? So you're prostituting your values, or you could be prostituting your time, you could be prostituting your love, you could, there's so much you could be prostituting. And there's an archetype that's a survival archetype, and it could be an emotionally survival, it could be a financial survival. And a lot of Czech practitioners work with those survival archetypes when they work with their clients, because a lot of change that and transformation that occurs with programs, and it it has to take place within here. because it's not just a mental game of following a nutrition guideline and exercise program. That's all just mental. Because when you take those things away, you don't. What do you have? You still have all the messed up shit that brought you to these habits and this process and these thoughts that make you think you have to be this way or do these things and live the life that stresses you out, that makes you sick, right? Like, that's all still going to be there. So if you don't work on those things, um, that's why working with archetypes is so important, and recognizing that shadow and that archetype the way that you did. um, I thought that was so powerful when you shared that, because a lot of coaches and a lot of Czech practitioners that I know have gotten to know very well, just being in the Czech Institute, going through the program, um, are very special, I want to say, breed of coaches, because it's like they're doing the fire walk in the program. Like, because in order to be a Czech practitioner, you've got to do the work first yourself, on yourself. Like, you're the first client for yourself, and you cannot pass any tests, any exams, or get any certifications and go to the next level until you've done it on yourself and proven it. And so they do the fire walk, right? The proverbial metaphorical. And that was like part of it for you. That was like one of your fire walks,
Oh,
I
right.
guess. Is realizing this, is like going through all of this hard change, but there was the good part of it, right? Like, going from staying up all night and drinking and kind of having this like fun lifestyle, and then suddenly you had a little bit of discipline and mental clarity because you weren't eating like shit all the time and drinking all the time, and you know so there was the good part of it. And so
Yeah.
when people look at those, because I will say, and I'm not calling anyone out, but I will say there are a lot of people who look at those who do competitions and have a lot of judgment towards those who do competitions, and oh, you're just full of yourself, that's superficial, or that's so narcissistic, and all of this. And I've worked with a lot of clients in the past who did competitions, and I can say right off the bat, that's like the very opposite. I mean, would that be your experience, that that's so opposite of, I mean, there is some narcissism in that industry, but those who do competitions are looking for something. It's not narcissistic. Would you agree?
Right. Everybody that steps on that stage has a story of how they got there. I remember seeing this woman. We were just like, is she in our category? Or she didn't look like she had like 10% body fat. She had more body fat. But whenever we visited with her, she had lost 190 pounds. So we're like, hell yeah, go on
That's
that
amazing.
stage. That is so amazing. And she was 59 years old. So I was just so proud, and like, it's just so beautiful, the journey that everybody at that competition has been through. Somebody has gone from like, you never know. Somebody like me, I this working doing a competition possibly saved me from driving home drunk one night. Like, I got away from alcohol, and now I looked to exercise as my high, and then looking amazing, and then inspiring other possible like people in the Latin community that want to break the cycle of just being a stay-at-home mom, or I don't know, like being not knowing that they can put themselves out there or something like that. But yeah, everybody has a different journey, and doing these competitions was my first step in the journey. And then after that, there's like a lesson that you learn, and then from there you go towards other steps of enlightenment. And yeah, I think it's beautiful. It's just practicing the balance of it and knowing your why and why you are doing it. And if you do want to continue that, being a professional bodybuilder, just knowing to do it safe, and knowing your boundaries on, like knowing that your physique may be a certain way, and that if you think that you're going to have to take drugs or get multiple plastic surgeries to attain that may not be the sport for you.
Mm-hmm.
But yeah, I mean, bodybuilders really take care of themselves. The ones that have been in it for a long time. If you think that doing a competition is just going to get you skinny, you're going to get a contract with a nutrition supplement, and then you're going to gain all your 15 pounds right after that and go up and down. So horrible. Your career is not going to be long, and you're going to have multiple hormone imbalances. I'm not sure if bodybuilding was the culprit of my thyroid disorder, but now, I mean, I do have a thyroid disorder. My dad has a thyroid disorder. It's probably genetic. But that stress of that constant stress inside
Mm-hmm.
uh,
It could
is
definitely
going to
trigger
cause
it.
some disorder.
Yeah, it could definitely trigger that onset of that. Which, again, going back to, the body image and shame, and feeling like, as for women specifically, we do feel like we're always being looked at and that we are always being judged. We may not be in a bikini and on a stage, but no matter what we're doing, we do always feel like we are being judged and compared. So, as a parent, it doesn't matter what decision you make as a parent, you're going to be judged by somebody because you either did vaccinate your kid or didn't vaccinate your kid. You sent them to this school, not that school. You feed them this or not that. As a working mother, you're judged for not being home. As a stay-at-home mom, you're judged for not working and providing for the family. As women are like, it's no wonder that I think it was the rate of anti-anxiety medications in the United States has increased 620 something percent since the
Wow.
90s. Since the 90s. I read that in a
Wow.
Vox article. 620 something percent for women. That's just for women. And like, it's no wonder, because we're just constantly under the microscope and feeling like we have to please everybody, but everybody has a different opinion of how we should do something. And so, I mean, the answer could be easy, like, stop fucking trying to please everybody. But it really isn't that easy, because there's so much conditioning that we are carrying with us forward. And, um, that could be a whole totally different topic of like how women have their own shadows and their own accountability they need to bring forward too. But what I'm saying is, like, the judgment factor, the shame factor, the guilt factor, we carry that heavy, like, big time. And it's so difficult when, in wrapping all of this up together in like nice little pretty package, when we don't have connection. I mean, even you and I right now, we're on Skype, and it's so nice to see your pretty face. And it's great to have the connection but the convenience of Skype, because I'm a mother of 3, and I've got to travel all over God's creation here in Austin to get my children at this school, that school, and I've got a little one at home, and running a business and doing all of these things. So Skype is great, and coaching and having the remote accessibility is great, but when we feel so disconnected from others interpersonally together, like that lack of connection, there's an isolation factor where we are looking at the online communities and the social media, and the comparison is so hard to avoid. It's so hard to avoid it and not feel, even if we're not out there, we then are just judging ourselves. Where is that, like, how's that cycle, like, where's that taking us? And you, as working with clients yourself, and because you work with clients both online and in person, and
Right.
so, I mean, what is your take with that? I mean,
I love working with people in person. I would say that my job sometimes I work with too many people, I would say, because what I've learned is that I am somewhat of an empath and I really like connecting with people, but yet I also sometimes feel their emotions. So at the end of the day, I'm like, oh my gosh, I need to cut a bunch of cords and cut these energies that I've absorbed. And it's true for everybody. Like, we all really do connect with people's energies, and we all are intuitive.
Mm-hmm.
I've done, I guess, a little bit more work on that intuitive gift. Um, but yeah, sometimes I need to disconnect. I love working one on one with people. It's the best thing. Working online is good too. I just like being there to answer their questions in live time.
Mm-hmm.
I don't think that we should just like hand them a handout and then hopefully they're great.
Yeah.
We need to continue the connection.
Mm-hmm.
Human one on one is great. The second one would be something like this, like Skype. I mean, we're getting to know each other and we see each other's postures, and we see each other's body language. And, even right now, like, we can kind of assess, each other and help each other, just seeing each other. Um, but yeah, I think, just meeting the client where they're at. If it has to be online, that's great. In person is great. Working with somebody's exercise biomechanics, I think that would be better working one-on-one.
For sure.
But yeah, I do agree that we don't have enough connection. And sometimes when I see people that have this chronic fatigue and chronic depression, like, kids with self-esteem disorders, they just don't have enough connection. It's so crazy. Like, the amount of kids that are committing suicide, the
Mm-hmm.
amount of teens that are taking guns to school and going, like, having a rage at school because they just haven't connected with another human being and, like, gotten a hug or looked each other in the eye.
And how young
There's
they are now. Like,
how what?
how young they're getting now. Like, the ages, there's like the suicide ages that I'm reading about, like 9, 10, 11. It's like,
I know. Yeah, it's really crazy, but I think that us as health practitioners, I mean, this is why we should be here. And I think anybody watching this that's maybe thinking about becoming a wellness coach or a physical therapist or a doctor, nutritionist, yeah, look into that, because I think that connecting with health practitioners is very important, and we all need that type of connection and accountability, because our mental health is declining because our technology is increasing.
it's excessive. Yeah.
Yes.
And it's a stressor. There's 5 stressors, right? There's chemical stress, environmental stress, nutritional stress, mental emotional stress, and then EMF stress. Like, so if your health is out of whack and stress is a big part of it, you've got adrenal burnout, like, and EMF is one of them. Like, and you're in front of a computer all the time. Like, I mean, it helps us run businesses and talk to our family out of state, and it helps us do a lot. But I mean, it the downside of that is, of course, if you're texting and doing everything over email, you're not getting that personal touch. Is that? I mean, I feel like that's what you're saying. I like the Skype. I like the FaceTime if I'm going to work remotely with someone or a group. I prefer the faces um, because it's personal. But, being one-on-one with somebody, I think, as you do with your clients and your patients, is that they are there and you're there for them in that moment, and it's a present moment, and it's all about them and their information. You're gathering from them information that's not just a cookie cutter printout thing, PDF download that everybody, 300 other of your clients get. it's their information, and you're molding something that is applicable to just them, that's going to work for them, only them. You know, handing one of your clients a program isn't something they can copy and give to their friends, right? Because it wouldn't be relative. It wouldn't, that wouldn't apply. You know,
Right.
the information gathering, it's just has to be very personal. Um, and so I think that's why the check we keep saying check. The check program is
Mm-hmm.
amazing. Not because it does. I'm not saying because I'm a check practitioner. I'm saying it changed my life. It changed me as a human being, as a mother. It changed me, and so as a coach, you do still work remotely online with clients, or because I mean, funny enough, like you do
Yes.
online coaching, and but you prefer FaceTime and Skype, correct?
Yeah.
Okay.
Yeah. I do Zoom calls and
Okay.
um, sometimes like FaceTime. Yeah. Um, I love working in the client's kitchen. So sometimes I'll go to their house and be in their environment, which they're just a lot more open, and we don't feel like we're in a sterile environment. And we get to like walk through their house and um, look at their kitchen, clean out their pantry, look at how they're sleeping. Maybe it'll invite the conversation of, like how their room is set up to like improve their sex life or improve their sleep, like, things like that. And
I
so,
love that.
yeah,
That's
there's
awesome.
so many things to a person getting well. But like the most important thing that I'm sure you've worked with your client is that we meet people where they are. And if they don't want to talk about emotions, then we'll just talk about their physical body. Um, in my experience, they don't want to talk about emotions, but yet I've done like a dry needling treatment on the patient's low back, and they start crying. Like I'm like, oh my gosh, does it hurt? They're like, no, I don't know why I'm crying. And
Yeah.
it's like, they have stored so much emotion in their low back, which possibly means, in a metaphysical definition, it some way means like there has been some burden with their life in transition, or the support, or an issue with money or career.
Mhm.
Or they've just held their emotion in their low back. But it's a great release, to work one on one with somebody and be there for them whenever they do have the release, because we just all want to be held, and it's great to be in a presence of another person that's going to help you, be there for you whenever you're ready to be vulnerable.
Mhm. Yeah. I mean, I
We don't get vulnerable enough, huh?
no, no. I have a like. It's so funny because I talk all about being authentic and vulnerable, but I think I talk about that so much is because one, I have no problem being authentic. I can be pretty provocative with it and almost like a little over the edge. But I'm very much stress vulnerability because I myself have a very difficult time with vulnerability. Um, it makes me very uncomfortable, like really, really uncomfortable. Even last night, Alex, I was making him sleep on the couch the night before because he kept snoring, and I was so tired. I was like, I'm not gonna go another night, and I don't want to risk you being stuffed up, or snoring, and me not sleeping. So you have to sleep on the couch. I feel really bad saying this, but world, I'm being authentic and I'm sharing. And so I made my poor husband sleep on the couch. And then last night, I wanted to tell him that I want him to, because he asked, he said, would you like me to sleep on the couch again tonight? And I didn't want to say no because I didn't want to say, I want you to sleep in bed with me. Like, that stupid little thing was so vulnerable for me. And he likes to like poke and be like, do you want to tell me that you want me in bed with you? And I like go to the pantry and I'm like wrestling with the supplement box, and I'm like, have you seen the vitamin B? And like Sarah, and he'll like poke, and it's just I'm so uncomfortable with it still, even after all the shit I've been through, all the stuff that I have even shared openly with people. Like I still have a hard time being vulnerable and saying mushy things. Like I still get like really flushed and red if I accidentally say babe when I'm talking to him.
Wow.
Yes, yeah. Mhm.
Showing affection.
Yes. I'm like, and he'll go, "Did you call me babe?" And
Aww.
I'm just like, I'm even getting like a little hot back here right now, just like talking about it. It's so funny. It's so funny. But vulnerability is so, so important, and it's a great part and a great tool with coaching because I tend to be, Alex and I work together, and he's actually the very vulnerable, soft, sensitive, you know, funny enough, practitioner. And I am more of the like straight shooter, like, don't bullshit with me. I see right through this. Like, so certain clients I work with and certain ones he works with. And I definitely am very compassionate and can be very soft. But if I see a client trying to tug at me and get me to be the mother, that's where I'm like, cut to the bullshit, and I see right through the game that you're playing, and I'm not going to waste your money and my hours dancing this dance for the next month, 2 months, 3 months. Like, tell me about your dad, period. Like, you see this chart, you see all these numbers, see all these like colors right here. This is all on your right side. This is all right here in your kidneys. And like, I'll point these things out, and then I just go right to it. And a lot of times that's just ripping the band-aid off very quickly, and we get right to it. But I prefer larger crowds and groups and teaching. Um, when I work with individuals, it's more of a specialized, advanced sort of program. Somebody who's deeply, deeply hurting and wanting to get through something traumatic and emotional, and they trust me. Um, and so we tend to look for the practitioners that have that capability to work with somebody one on one and can take on those people who are looking for the holistic model without the BS, without the follow my program and follow my Instagram, follow me, and like me, look at my butt, follow me. And we are looking for those who are really truly aligned with the holistic model, the message, and getting a client or a patient to be able to not need it, right? To be able to teach them and empower them into bringing in awareness to their body so they know how to read their body signals. They know when they're not eating the right way, and they know that they're not getting enough rest, or they're not doing the right exercises, and so on and so on. So, um, long story short, that's why I asked you to be here, because you're one of those practitioners. You're one of those people who is not a bunch of fluff and glitter, and you're very factual based, you're very scientific based, but you're also full of heart, full of compassion, and full of connecting to people. And your desire is their success. Like, that's the whole point. Those are the people we're trying to connect and get our communities to connect to. And so, yeah, she has Instagram, and she's on Facebook. You can find her in all these places, but um, finding a coach that you can connect to who's going to treat you like a person, like a human being. Like, I would send anybody to Cristi, like, with no questions asked. I mean, well, like, what's your email and phone number, and I'll send you over. But like, she's one of those people. She's all heart, and I mean, like, you can just see it on her face. Look at her smile right there.
Aww.
Yeah, she's
I
awesome.
appreciate that very much.
Yeah.
Yeah, and I appreciate it because I don't know. Sometimes I don't see it, just like every other practitioner. That like I see you and Alex like amazing practitioners, and I, we all like know the same thing. We have a different angle and we have different styles, and for me to get that compliment from you is it's very valuable to me. So thank you.
Well, I mean, it's
Yeah.
it's an almost an obvious thing, like anybody who meets you and knows you. But like I said, your videos, which I will be linked at the bottom of this, anywhere this audio or video is published. All of her videos are just so informational,
Oh, right.
and empowering. It's no fluff, right? It's no and it's not for entertainment. It's for success and empowerment and education, and that is like what I would say is a takeaway if you're looking for a coach or a practitioner or a care provider. Look for somebody who's not trying to entertain you and get likes. Look for somebody who's trying to help you and
Yeah.
provide you with guidance. And yeah, so Cristi's got a lot of that on her videos and her website, and it's just full of content that's empowering information. And so a lot of those links, we covered some of those topics, but some of them we didn't. But I think are relative, so they're gonna be at the bottom here. You should check them out, and they're all there for your viewing and
Yeah.
reading pleasure or empowerment and education. Um, and it's good stuff. It's good stuff.
Yeah. And I just want to offer that there's different ways or levels to work with me. And one is in the clinic with people that are in pain, have had injury, think that they need physical therapy. They need a script from their doctor to see me in the clinic. Um, and there I do all modalities like therapeutic exercise, massage modalities. Dry needling is the big thing that helps people with muscular spasms. And then the second level is working as a holistic lifestyle coach, and it's getting the basic like type of exercise that every person wants for their wellness and improve, helping them lose weight, eat better, knowing what their metabolism is like and what they should be eating, not doing, how their sleep should be, what are their career goals, things like that. A nice wellness circle or wellness wheel. And then there's a higher level where people have some type of disease or some like thing that they just, it's been chronic and they really want a little bit more special treatment or something that they really want to dive into, say like an autoimmune disease or something with hormones or something like that. And that's a little more special and more medical and not medical, but it's a little more specialized. And so definitely like that may take a longer one-on-one relationship, but I'm open to like different levels of working with patients. So there's multiple ways that they can work with me, I'm trying to say.
That's awesome. That's awesome,
Cool.
though.
Yeah.
And I really do like the HLC way, the holistic wellness wheel. I really do like that, and
Yeah.
the incorporating everything into it. Because if you're not happy, then anything you put into diet and exercise is just like you're still gonna be unhappy, and eventually you're gonna go back to habits that bring you happiness that are not good for your health, right? So
Right.
always incorporating everything in a balance is so great, and that's why the model that you work with is in my eyes, in our eyes, is just like undebatable. You don't need a lot of science to figure it out, and it's just so it's built to be success, and it's not really built or constructed. It just is what it is, and there's nothing but success on the other end of that. And so I love what you do, and I'm so glad you're here in Austin where we are. And I hope next time at the next meetup that you're there.
Yes.
I won't get all excited and then show up disappointed, even though I love everybody there. Um, and so next time I will. So this will be chopped up into about